Hi, Assalamualaikum, and welcome back to all of our viewers of Sinar Daily's Life and Style podcast. So you guys are here back with me, Dr. Zahilah as your host, and today we're going to talk on a very, very interesting topic. This is a lot of misconception and also a lot of, I would say, opinions about this. So what we're going to touch today is on autism. What we hope to come out from our discussion today, from our podcast, is that to shift from the public, from just being aware of this condition, we hope that the public out there would try to accept and try to listen, try to understand to this group of special individuals. And together with me today, I am so blessed to have two experts, I would say, in autism. My left hand most, I have Dr. Zahilah. I don't think so both of them need any introduction actually, because both of them have such thousands of viewers on their TikToks and also their IGs. Dr. Zahilah Filzah is a consultant, paediatrician, and passionate advocate for neurodiversity and autism acceptance. She's also the associate consultant at AT Autism from the UK. Welcome, Dr. Zahilah.
Thank you for having me.
And on my left-hand side, also Irin Putri. She is a super mom. She's a mother. She's a, I would say, producer, TV host, name it. And then also she's also an autism advocate. She has shared her journey and also her experiences raising his son, Raees, which is an autism. And I'm so happy to have you today. Thank you for making time for our podcast today for both of our panels.
Thank you for the invitation.
All right, so let's not waste any more time. Let's just dive into the matter. I'm sure there's a lot of burning questions. I also have a lot of burning questions. It's not something that I discuss every now and then. So first and foremost, of course, we're going to go to the expert, okay? To our consultant pediatrician, Dr. Zahilah. Can you just share actually, how did you start your journey from a consultant pediatrician and after that more towards autism, and what this term that we have, neurodiversity, neuroaffirming, it's all new terms for me at least. So maybe you could just explain how was your journey? I mean, how did you actually continue and wanting to do about autism?
Right. So I've been in the medical field for about 20 years now, yeah, but became a specialist in 2010. So my journey in autism started in the clinic, in the pediatric clinic. But what I realized, I only truly learned about autism outside the clinical walls, yeah, when I spoke to autistic individuals, yeah. So I don't know if I have time for this, but if I were to share this story that actually was the thing that changed my perspective, yeah. So I had this boy who was in my ward, and when we were doing rounds, I came to him, and he was really at his bed because he was attached to his fluid therapy, yeah, and he was just gazing outside the window. So as I approached with my team, and then we were, my team started to, present about him, and this is boy who comes with diarrhea, vomiting, is autistic. Now all this time he was just looking outside the window, not a blink of eye. Yeah, so I went to the mom and I said, "Hi mom, I'm Dr. Zahilah as usual. So I'm going to examine him." I also spoke to him, right? And the mom said, "Doctor, I am sorry, he will not be responding to you because he doesn't speak." And I said, "It's okay." So I went on and examined him and whatnot. And then the mom at one point was like, "Doctor," maybe because I keep speaking to him, yeah. And then the mom said, "Doctor, I'm so sorry he's not responding to you." And I said, "It's okay. I know he understands." And that was when the mom said, "Doctor," she got excited. Said, "Yes, he does understand Malay. He also understands English." And that was time, after I finished my examination, I stood up and I looked at him. And I didn't know why I said it, yeah, but I said, I know you understand us very well. It is us who do not understand you." And he stood up and gave me a kiss.
Oh.
And all those while before that, he was just gazing outside the window, right? So that made me think, what if what we think we know about autism is fundamentally flawed? Right? So that was when I went on to do my master's in autism, which isn't a medical pathway. Yeah? And this is where I learned about neurodiversity and social justice movement and what exactly it's like to be autistic. Because we always see behaviors, right?
Yeah.
And we judge them. We think that we can see autism. because we see the behavior, and then sometimes you see kids, because the idea is always about children. It's always about kids, not having eye contact, kids who stims, and, kids who may be rolling on the
tantrum,
floor.
that kind of thing, right?
Menstruum is always thought to be tantrum, yeah? And that's what we think we know. And therefore, what this realization coming from listening to participatory autism research, because we've always looked at research that is actually designed by neurotypical researchers. Yeah, but this is led by autistic researchers, and it's different. It's different. Yeah, and that's when I changed, and it continued to influence how I work. So coming back to your question, neurodiversity is basically a natural variation of the human mind, right? There's no one way to think. There's no one way to be. We all process the world differently. If we can accept animals, there's so many kinds of animal. You're not going to say lion is better than a tiger, right?
True.
You're not going to say an orchid is better than a rose. But what is it when it comes to human? We think that there can only be one way. So in a nutshell.
I understand. So meaning that because 1 + 1 is 2, 2 + 0 is 2 as well. So we can't just generalize and make it all the same for everyone, isn't it? Okay, now let's move on to Irin. Okay, as a mother of, having an autistic child, how has that changed? Like Dr. Zahilah explained in terms of professional, more of an expert point of view. How has it changed prior to, before Raees was born and after Raees was born? How would you have perceived autism? Has it been different from before and after?
I had hardly any knowledge about autism before Raees was born. Probably I watched in the movies. Probably there was a kid with the autistic character, but that's all I knew. I knew they were had something behavioral differences, but that was it. So, but when I had Raees, I made sure that he followed his milestones actually. So I made sure that he walked at the right age, he crawled at the right age, but then somehow at 2 years old, I noticed one red flag that was really, really big, which is he didn't speak. His communication skills were not at par as a child should be at 2. Mm-hmm. So I highlighted this to his paediatrician, and his paediatrician said, we observe for another 6 months, but within the 6 months, you have to, let him socialize more, mingle with other kids, play more, and then we'll see. So did all that, and after 6 months, there were not much improvements. So that's when she referred him to a child psychologist who eventually diagnosed him with autism. But prior to that, I really did my own research because I asked questions. I Googled everything. I asked, why isn't my son talking? Why isn't he looking at me in the eye? Why isn't he responding to his name? And a few other signs. And all the answers that came back to me was, these are signs of autism. Mm-hmm. So even before my son was actually diagnosed with autism, somehow those clues were given to me. Mm-hmm. So when it was finally diagnosed, it didn't come as a big shock. At least I was somehow mentally prepared for that. Yeah.
All right. So, from your experience, is there any misconception that probably you had that misconception before, and now when you are dealing with an autistic child, so you feel that this is actually some misconception? Maybe later Dr. Zahilah also can explain from a professional point of view. Is there any misconception that you think that the public has been pointing towards this group of individuals?
Okay, when we say autism, the first thing they think about is tantrum. But the spectrum is wide. Some of them are we can't really tell even that they have autism. So because the spectrum is really, really, really big. Sorry. So but for me, from my experience, Alhamdulillah, Raees, my son, he has never experienced tantrum.
Okay.
Yeah. If he doesn't get something or something doesn't go his way, he'll just be really sad. Oh. He'll just cry and wail, but he wouldn't be like throwing stuff or making a lot of mess or anything like that. So yeah. So when it comes to autism, that's the picture that is being
portrayed.
Painted, portrayed to the public. It's very typical autism, but the spectrum is wide. They are really smart. They have they have strengths if we know where to tap.
Yeah, like Raees. He's multi-talented. I've just heard that she did some, I don't know, I would say duet or something with Marsha, right? About for the song of Fening Rindu on your TikTok, isn't it?
Yeah.
Okay, so now let's hear from Dr. Zahilah regarding the common misconception that the public has. Because like what Irin said, sometimes when the child does not have the proper gaze, they don't look at you, when they don't reach certain milestone, most of the time we always have that perception, oh, your child must be autistic. You need to bring your child to see a child psychologist. So what do you have to say in terms of that, Dr. Zahilah?
In terms of misconception, there is a lot. There is a lot. And I hold on those misconceptions for a very long time. Yeah. And the thing is, we still have those misconceptions. I don't think anyone would understand an autistic unless an autistic themselves. Sometimes it's easy to say, I was trained in this, or I parent a child, and we think we know. We know to a certain extent, right? But a lot of the things that we know is very from the outside. It's like from the outside looking in. Yeah, that's why I say a lot of the things that we think we can see autism, but it's actually invisible. So the only way to understand autism truly must be through the autistic community. That's the biggest change. That's when I realized, oh my God, there's a lot of misconception, and there's a lot of misunderstanding, and it's an injustice, right? So if we think about, say you were saying about an eye contact, for example. For a layperson, when you look at someone who's not having eye contact, when the rest of us have eye contact, we think that person is not listening, being disrespectful, disengaged, right? But an eye contact, when we think about eye contact, when we ask the autistic community, why is it that it's hard for them to give an eye contact? And sometimes, just to be clear, it's not always not having eye contact. It's a variation in how the eye contact is, because for some autistic, it is an intense eye contact, right? So this is because, especially those who do not have, do not give you eye contact, they're listening. And in fact, they listen so much better when they're not looking at you. Because you've got to understand the way they experience the world, it's not like us. As we are speaking now, Dr. Hamizah, right? Yeah. You hear my voice. Yeah. And I am very aware of my voice too, right? But if we take a moment of silence, there are other sounds in this room. And to them, it is all at the same volume, for many of them. And if they were to have to process that, and at the same time have to look at you, and when they look at you, they see so many things, right? There's so many things that have to be processed at the same time. So the best way is to avert their eyes so they don't have to process this visual, but so that they can just give you that attention and try to understand what you're trying to say. So imagine someone who is struggling with that, and we say, look at me. And they're already struggling. They try to focus on what you're saying. And then here you are trying to make it more difficult. But I understand from many people, it's well-meaning because they think that you need to have eye contact. But eye contact is not just about in autism. There's a lot of other culture out there. Some African cultures, Afghans who do not give eye contact, right? Yeah.
Yeah, okay. So that's actually a different perspective that I would say, because we always have that misconception that you have to listen, but we don't understand, like Dr. Zahilah said, from their point of view, because they are processing a lot of things and we're just adding more stress to them. So which is very, very, I would say, injustice to them, isn't it?
Yeah, if I could just add a bit.
Sure, no problem.
Among the things that were said to me about my son is, I think he has hearing issues because he's not looking at us when you call his name, but actually not. He needs more discipline. When he does things that probably make a mess or something like that, is because he needs more discipline. And then probably he needs to have more things to do. He's bored. Yeah.
Oh, common. That's common.
Right.
That's right.
And then it doesn't add stress to the patient itself. Yeah. It's adding stress to the family itself, because it's not very easy to manage. And somehow you are telling them what they need to do, but they have already enough on their plate, isn't it?
And it's not right.
Yeah, true.
Because it doesn't. You think that's what it is, but it's not.
Yeah. Because some people are, they want to be the expert, but they're actually not an expert at all, isn't it? So just want to talk about on Dr. Zahilah. How can you actually educate people? Because now we're talking about the neurodiversity, neuroaffirming. how would actually, because rather than focusing, when we talk about autism, we always say, I mean, in a medical point of view, sometimes it's like a disease. And like if I as a medical doctor, I would say disease needs to be treated. So in the mind of the public, they would say, this is a disease and we have to treat it and we have to fix it. I mean, they are very focused on the fixing part of it. But how do you educate the public towards the approach that prioritize in terms of respect? Actually, we need to make sure the public respect these autistic individuals, understand them, and also support them instead, rather than making all these assumptions and also judgments.
Get to know an autistic. I think that's important. But also, even when you know an autistic, if you're still looking from the lens of, the typical lens, neurotypical lens, how you see it, you will not understand it, right? And I think that's when neurodiversity demands humanity in us, right? Because when we talk about, and this is the other, if I could just add, when we talk about empathy, right?
Yep.
Another misconception is that autistic lacks empathy. But what I've learned is that we lack empathy. We lack empathy. What does empathy mean? Empathy means it's putting yourself in that person's shoe.
Yeah.
But this is not what's happening, right? You're still looking at them from your shoe. Yeah. You think you understand, right? You're dictating this and saying all those things to you, Irin, right? But this is a common thing parents tell me. But in the beginning of every parent's journey, it's always that denial, listening to all these things that are being said to them. But as they realize, as you live your, because it's not an object for you to handle. It's not an object for you to manage. It's your loved one that you live with.
Yeah, sure.
So the way you look at it is different. And those who do not have that lived experience may not have the kind of experience you have, right? But coming to, gosh, sorry, I lupa soalan dia.
So basically, how do you actually, how the public, how you want to make the public to go more, other than fixing towards take the focus away from fixing the problem, autism, but towards understand them and adapt to their condition?
I think one of the ways that when I think about this, right, I think there's a lot of double standard. Okay, let me just give you an example. We spoke earlier about tantrum, right? The thing is, a lot of children have tantrum. Yeah, but tantrum is very different from an autistic meltdown, right? A tantrum is when you want to have something. There's a secondary gain. Say he's holding an iPad, he's watching it, and you take it away, and then he starts crying, right?
Yeah.
And he stomps his feet and he screams. That's tantrum because that's a secondary gain, which is he wants his iPad back, and there is an audience, which is the mom who's holding perhaps the iPad. But meltdown is different. Meltdown does not require an audience. Yeah, meltdown is not something they can control. Yeah, it is because of sensory. Yeah, being overwhelmed with all the sensory input. It could be due to being overwhelmed with emotion. Yeah, and loss of autonomy, for example. Suddenly, you imagine someone who does not have choice and control. And you have someone you have people talking about them, this, that, and all that. And it's all misunderstanding, and you can't respond back. And when you talk about meltdown, it's not something like, again, it's not something that you want to correct, something that you want to punish or discipline, but you want to empathize with. And now, if we just think about emotion and we think about our behavior, I see so many people, adults, who also scream, who throw things. Sometimes it can be even in the hospital back in those days where your one would throw your
folders down.
Folders. Yeah. Why is that accepted?
Sure.
When you see those kind of behavior, you say, "Oh, he had a tough day."
Or he's like that.
He's had a tough day, and all. There were so many things on his plate. All this. But when we see an autistic, oh, that's autism, right? That's double standard. Yeah. So, and that is why neurodiversity brings us to think about how we look at these assumptions and challenge that narrative. Yeah. Challenge that narrative that, hey, take a step back, think, maybe you're not getting this right,
All right, okay, yeah, because we always feel that we are the neurotypical. Like, for example, maybe I label myself neurotypical, but I think prior to this, we just had a conversation with Dr. Zahilah. He said, maybe you think that you're neurotypical, but you might be one of the. I mean, because it's a spectrum. You can be a neurodiversity. I mean,
because it's the way we think, right? The way we experience the world. It's not what you see, because the one you see, the way we talk about in children is very stereotypical.
Yeah.
That's a very But I mean, I shared with you that there is a organization called Autistic Doctors International, right? Autistic Doctors International, where it is a group of autistic doctors in the UK and some other countries. It is led by an anesthesiologist who found out she was autistic after her son was diagnosed. Wow. It runs in families. It's genetic. So I don't know if people like to hear this, right? Because the way I see it, because it's not a disorder, it's not a disease. If a child is autistic, very likely one or either or both of the parents are autistic too, but they are on different spectrum.
Yeah. Something to know about that. In anesthesiologists, I mean, we want to correct the misconception, not just because we always have that autism, they won't do very well. They are at a certain level of they are mentally challenged. But like Dr. Zahilah said, we do have who are anesthesiologists who led the whole autism community. So which is very, very great. Yeah. Okay, next to Dr. Zahilah, I just want to ask in terms of the environment, I mean, from your point of view, from your journey, from your experience, what is the suitable environment for an autistic child to thrive actually, and how we, the non-autistic, can help them in that way? I mean, for us to adapt to that environment. Okay,
just to start off, right? A lot of people think, I am not saying that early intervention program is not important. I'm not saying speech therapy or occupational therapy is not important. I hope that's, that gets across. Yeah. I think what sometimes we're missing is that we often think that autistic behavior is a reflection of an internal state. To a certain extent, yeah. But majority of the time, it is because of the interaction with the environment. Yeah. If, for example, the thing, I think you mentioned earlier, right? You said about you were looking at the developmental milestone, because we always, when we talk about autism or any other neurodivergence for that matter, it's always about comparing them to the typical milestone. And this is when it gets a little blurry for most people, because I hear a lot of people say that parents are in denial. But the thing is, parents do sometimes see, and this is the thing about autistic, they have spiky profile. So the things that other people may not be able to do, they can do. And the thing that other people is easy for other people is hard for them. So what parents see and what professionals see is different. So if we celebrate that this spiky profile, and also across time. So I give you an example. A child may be doing, say, whatever you're doing. Let's say you're working on something, and he's doing it, and suddenly you feel like at another time he's not doing it. And I said, "Why are you not doing? You know you can do it. I know you can do it. And why is it that this time you refuse to do it?" It could be the environment. The environment changed. So we talk about the environment, how it influences the autistic. And this is what we learn from autistic adults. We cannot understand. If we want that, I often advocate for, if we want to help and support autistic children and teenagers, we must listen to autistic adults. And you all refer to me as an expert. I wouldn't call myself an expert. The expert is the autistic community. Yeah. So, I look at it in this acronym of SPELL, because I train people in that. So SPELL is actually a way of organizing the environment. And it is co-designed with autistic researchers and autistic professionals. So when we talk about structure, it's about providing predictability. If suddenly you say, "Hey, let's go here," and they already have a structure in their mind, but out of nowhere, you tell them that, "Okay, this needs to be done instead." It's like having a precise mind in a chaotic world. Right? So they're very precise in their mind. Yeah? And they pay attention to detail. So if you don't provide structure, then that's going to be very hard on them. Positive approach, attitude, and expectation. When you see a non-speaking, do you think they're not smart? So people think, so we see you try and do speech therapy for some time, and then they're still not speaking. And then what I see, that's most parents say, "He can't speak. I just have to guess what it is that he wants." But there are other means, and now we have what we call augmentative and alternative communication. I recommend this across all spectrum, because what we understand from autistic adults is that even when they can speak, you know that they can speak, there are times that they just lose it.
All right.
Sometimes they have autistic burnout.
Okay.
They suddenly cannot speak. They just lose the words for it. Yeah, and the other thing, E is empathy. Empathize in terms of their sensory experience. So when for sensory experience and their communication, for example, if you have an adult who's not speaking and then you're not providing, now you can have the AAC, the augmented communication, in an app where you can point to pictures or you can type and it generates speech. Imagine even for a child who, when every time they cry, people assume he wants milk when actually he wants Vitagen, for example. How would you know if it's not in the house? Unless they can point, you can use communication board. Low arousal means SL, the other L is because there's so many arousing thing around us, like lights, sounds, and all that, people, right? Is to keep the environment low arousal. But it's not just that. It's not just the environment. It's also about our communication and interaction to them. Right? Imagine when someone is having a meltdown, and there you are. Why are you behaving like this? When will you stop? Have I not teach you? You make it worse. It adds to the stress, and it becomes longer. And then people get stressed. Other people get stressed and say, this is right. Everybody gets stressed, and then they called it challenging behavior. But when exactly it is a distress behavior, right? And the last one is L-Link. It's basically working with everyone. And I think we must give credit. So in the UK, in the national autism training program, they call parents, and they train parents, and they call them experts by experience. People who support autistics, educators, teachers, therapists, doctors must work collaboratively with parents. You must listen to parents. But more importantly, of course, to listen to the autistic community, because parents don't always understand it. Yeah, because we're still looking at it from a different lens. So in a nutshell, that nutshell's too long.
No, it's a good nutshell. So basically, it's just to have a conducive environment for the children, for the autistic individuals to thrive. I mean, we cannot expect, like you said, empathy. We cannot expect them. I mean, we always want them to be in our shoes, but we never try to put ourselves in their shoes, trying to understand what they want actually, rather than what we want, right? Okay, now going to Irin, from your experience, okay, from as Raees grows older, how does it, I mean, for Raees and also for you, the pressure to fit in? Because I think Malaysia probably not as very well aware and educated, I mean, in terms of this as per in UK. But I think slowly we're getting there. How is it like the pressure that you have initially to make probably the closest from their families or from your close friends, and then for Raees to fit, to try to be like a normal boy? I mean, how is that? And can you just share in terms of that?
Okay, because what I do is right now, in terms of autism advocacy, the main reason is for me to help the society understand autism better, because I know that's where the future is, where Raees will grow and he'll be an adult soon. So he needs to be in an environment where people understand him as well. So what I do now is advocacy through my sharing on social media and through podcasts like this. Yeah, it's part of my, it's like my jihad, like, to help raise awareness. So it's all part and parcel as for Raees, because him and other autistic individuals, because for him, alhamdulillah, he has the gift in music. So I foresee that could be where he will be able to, one day be independent, probably get his own income via music. So besides advocacy, I also right now I expose his talents, his journey. Hopefully, he will have like a strong fan base. We don't know. We start early so that he has a following, so that in the future he will be, people will know him, and probably he has a strong following, and it would help in his future career, probably in music. That's what the path that is being created right now for him. Yeah. So and for me, to have him, to be like a normal child, I it's not something that I aim, because he just needs to be himself. He just needs to be himself, and it's others that need to understand him.
Yeah, he's just special in his own ways, right?
That's
and all
right.
of us are special in our own ways, isn't it?
So it's like 2 days ago, I brought him to an event. It was very crowded, very noisy, but he was fine.
Okay.
And he was happy to be there, and other people were not bothered by him just, walking around. And so he didn't bother anybody, that's one thing. And others were not, bothered that he was walking around the room. So as long as he's not bothering anyone and he's happy, I'm fine.
Okay.
Yeah.
Maybe Irin can just share a little bit. How do you manage in terms of handle the moments when Raees express himself not in a very appropriate manner? Maybe some tips and tricks for the parents out there. How do you manage that?
Okay, if I could share one incident, sure. Okay, it was the first time that me and Raees were involved in a shoot.
Mm-hmm.
So it was the venue was at a bungalow that the production rented for the shoot, and somehow the shoot extended until probably like past 10, past 11, and he has a very specific timing where he should be home by 11 at least, but the shoot was still going on and up to 11:30, 12, and I was like, okay, Raees, just a bit more, because he was playing the piano, and he was in a way one of the highlight of the show. Okay. So if the main character isn't cooperating, the whole thing will be go down the drain lah. So he was very patient. At first, he needed to take 5. Let him take 5 and then continue. Mm-hmm. But there's just one instance, I guess his patience was wearing thin, and he was just like, I'm not gonna do it. He just took my bag, and he just took my bag, and he wanted me to follow him. And he started crying. Okay, because he doesn't have meltdowns or tantrum, but he cries lah. He was really, really crying. He was no longer cooperating that time. So I told everybody there, can you just give me a moment, just calm him down. So I put him aside, I talked to him nicely, because probably some parents would be like forcing him, like, just please one more time, no. But for me, it's like, we have to slow talk. Yeah. So when I tried to slow talk with him, and eventually he managed to finish the whole shoot. Yes.
Oh. Excellent.
Yeah.
But that's what, I think Dr. Zahilah has mentioned. We are trying to force them, because he already has his own structured program in his mind. At 11, he needs to be at home and sleep, like most of us should do. But sometimes you're trying to stretch them beyond whatever they're supposed to do. So they would have this, and we are blaming them for behaving like that, isn't it? So which is very, very much wrong.
Yeah, but what I learned from that is, if there are any engagements for a shoot or anything similar to that, I would put stop to them. I said maximum he could go is 10. Yeah, that's it. So, lesson learned.
And having a proper structure, and if in those events the organizer could actually give beforehand, like how it's going to be, like what time's going to come in, what's going to happen here and there, that would be even better. Because I think one of the other things that we misunderstand about meltdown or autistics in general is that there's this thing called autistic masking. Or autistic camouflaging.
Okay.
You see from the outside that everything is all right. Yeah? But inside it is not. So meltdown is not always externalized.
Okay.
It can be internalized. And masking means like sometimes you force yourself to behave in a way that you think people would accept you, meaning a neurotypical way, right? Or forcing yourself through sensory, overwhelming environment, and telling yourself just a little bit more, just a little bit more, just a little bit more. But the meltdown may not be externalized. It can be internalized. And why this understanding is important, because what we learn is that 70% of autistics have at least one mental health challenges, and 40% have at least 2. And I have, every time I do training, right? It's different when they're children and then they're growing up, and things change. Many of the parents have also shared, and also from my practice, that there are many autistic children who struggle with depression and anxiety, have suicidal thoughts. So, but a lot of them did not see that this was coming because it looks fine from the outside. Yeah, it looks fine from the outside because they're holding on until one point when they can't hold on. And the thing is, a lot of time, what we learn from the autistic community is that whenever there's a meltdown, whether it's externalized or internalized, or whether it could be about not wanting to continue with something, what follows through is guilt and shame. And so that is why in the National Health Service, it's like Ministry of Health in Malaysia and in the UK, they partnered with Autism and Anna Freud of University College London to train the mental health professionals through understanding autism from the inside. Yeah, and I think that's very crucial. And again, that's where misunderstanding happens because we're just looking at what's superficial. And therefore, like when we think about something, when you see a behavior, imagine the iceberg, what you're seeing, but let's say someone is throwing things or someone is crying, someone is that. What we see is that, because of this, because of that. But beneath it, there's a lot of other things, unmet needs, chronic loneliness, trauma and whatnot. Yeah.
Okay, there's a lot of, we could go on and on and on this, but I think I've got a cue that we are supposed to almost wrap this thing up. So before I end this, for all our audience out there, the parents, not just parents, in terms of the healthcare professionals, like for me, those who are managing autistic child, or even the public who probably you can see a lot of misconceptions. What are the last words, few words, and also some advices? Maybe Dr. Zahilah can start first.
Autism is a disability. Yeah, of course it's a difference, but it's also a disability because when the environment does not cater to your brain, it's disabling. And I think what is important for us to move forward is to remember this. It always takes two to tango, right? So when a communication and interaction break down, when you see, this is not C, they're not interacting our way, they're not communicating our way, they are already doing all the work. They go to therapy, they go, they suppress themselves to the extent of their mental health. Yep. The question is, because it takes two to tango, what are we doing? Yeah. So you can't, to me, if you want to advocate for autistics, we must advocate for a meaningful change in the environment. And we are the environment.
Yes. Okay, thank you so much. And how about Irin, your last few words to the public?
Okay, I hope we can make the environment better for autistic children or autistic individuals, to understand them, to, as what Doctor said, not through our lenses, but try to go into their world, delve into their world and see, somehow rationalize why they are being or behaving that way, instead of, hey, he's a naughty boy. So try to understand better. And also, of course, give support to other parents also, because parents with special children really need a lot of support. Yeah.
Right, thank you so much to both of our panels. It's such a it's a great discussion. I could go on furthermore, but I really want to know more about autism, but just because we have very limited time. Thank you. As a nutshell, as a conclusion, it's very important regarding the neurodiversity, because they are special in their ways, and we are also special in our ways as well. So we just have to respect, understand, and try to adapt, rather than wanting them to change their way to fit to our shoes instead of we being in their shoes. So to all our audience, don't forget to follow all Sinar Daily social media platforms and download Sinar Daily's new and improved mobile application. So I'll see you guys next month, inshallah. Assalamualaikum.